Hello and welcome back. I'm Eric Sunset, the host of the DocBuddy Journal. And today we're joined by Tim Burney. And Tim is the CEO and founding partner of Advantien. If you're not familiar with Advantien yet, let me make a quick introduction on Tim's behalf, and he'll give us a little more detail as well. Advantien's customized supply chain services help surgery centers increase profits and improve efficiencies for orthopedic and spinal implants. Tim, thanks for joining us.
Yeah, thanks, Eric. I'm thrilled to be with you. I appreciate that introduction, and if I can add to that, the implant part of the business is one of the highest cost, if not the highest cost area within an ASC space, and there are great opportunities to sort of support the ASC efforts to manage that business in a more efficient, more cost-effective way. And certainly that's what we strive to do at Advantien because we know that that's really important to the ASC space. And by the way, with the ASCs, they're, as you know, and I think our audience knows very well, surgeons are, the ones that generally, unlike the hospital where the surgeons go and they're basically going and doing surgery, if that's what they're doing in this case, they go to the ASC space and oftentimes they have ownership, which means that they care personally about all aspects of their business, right? They care about delivering the best quality through their ASC. Obviously, they're always concerned about and directed to provide the best patient care, and they do that every day, regardless of where the point of care is. But at the ASC space, there's a great opportunity to drive a low-cost solution and to be as efficient as possible that affects the patient in profound ways. They're coming in there and they get a great experience in an ASC, in an ambulatory surgery center. We've happened to focus on the orthopedic space because of the high cost center that it is and some inefficiencies that are built in. And so there's opportunities to help those surgery centers by partnering with them, fill in some gaps and help them be as efficient and cost effective as possible.
Well, you make a really key point here early in our chat that the ASC is one of the very few venues in healthcare where that value chain is totally aligned between the patient, the provider, and the payer. And that's great as a healthcare consumer. We all are to some extent, or at least we know one. But because of that, you end up with sort of some cost pressures that maybe a practice or a hospital doesn't necessarily experience to the same degree. And all I'm getting at here is that implants are like either the number one or the number two expense incurred at an orthopedic ASC.
Yeah, that's right. I mean, the only other one that probably competes with it is labor, but the bottom line is that it's a controllable expense to an extent, right? And the key to that, of course, is to understand, what your cost means. I mean, the challenge for the ASCs, among other things, is that they've got really good people, and good people like to go to the ASC space because it's a great work environment. Like you said, from a patient perspective, I mean, when you look at the surgeons, the nurses, everyone, they're focused as they are in a hospital, but they have more control in the ASC space to deliver this patient-centric sort of care that is a greater value. And by the way, ASCs, right? If it's an orthopedic ASC specifically, that's all they do. If it's an orthopedic combined with some other specialties, they're always focused on specific care as opposed to going to hospital where you have sick people and other things. But that's that's part of the discussion. But the bottom line is, yes, it's a potentially efficient, cost effective, very high quality space for patients. And so it's important that there are solutions to help ASCs to partner with them, and there are, to help them identify those opportunities, help them drive the solutions, and to in a very high cost setting. So that's what we focus on, and other companies as well focus on.
Yeah, and to that point, when you think about operating the ASC as the business that they are, obviously patient outcomes are first and foremost. But to be able to continue providing any type of patient outcome, you need to keep the lights on. You need to be in the black, so to speak, in every procedure that you perform. So knowing that the cost of implants is a top two or top three expense incurred at the ASC, we know that staffing is really thin. Do you see it becoming sort of set and forget when you're talking about managing the cost of implants? I imagine there's a better way.
Yeah, so the challenges of hiring, I mean, it's in lots of spaces, right? Not just the healthcare or the ASC space, but everywhere. But specific to the ASC space, what I see and what we see is that again, they have really good quality people, but there's still challenges. I mean, and what do you end up? Who do you end up hiring? Do they have specific to our discussion on implant and cost? Do these people they're hiring have the specific knowledge and expertise to assess the opportunities to improve on cost efficiencies, et cetera? And the solutions that are available, whether we provide them or someone else does, are to help to partner with these people who are the materials managers, who are the administrators, and to provide them with solutions. For example, when you think about cost, what's the most important thing that you can do? Number one is understand what is your cost structure, right? What is the data around, what are you spending for the specific implants that you're using, right? And all surgeons have their own specific implants they want to use. So the goal should not be to drive them to another implant because you're going to get pushed back, and for good reason. That's what they were trained on. So you think about that and you think, well, what are the opportunities? You look at the data and you look at what they're using and then understanding that data, right? So number one is getting the data, and it's often available through different, like NV and through HST and that sort of thing. But a lot of times the materials managers administrators, maybe they know how to pull it, but then what do you do with that data, right? What does it mean? And so what does that mean? Well, what are you looking for? How do you compare it to what the benchmarking is, maybe across the country or for a specific size ASC or whatever that is? The bottom line is, how do you identify the opportunity to drive cost savings? And that is truly in the data. So you need people that understand the data, number one, the nuances that exist between different types of implants. For example, there are over 150 different implant manufacturers in spine alone. I'm talking about those companies that manufacture implants and then those companies that sell those implants. Sometimes at the same time, sometimes they're different. But you need to understand those nuances between those different implants. You can't just compare a Stryker implant to a Medtronic necessarily. Sometimes you can, but you need to understand when you can do that. So the bottom line there is being able to have the insight and the expertise to make those decisions. So again, the ASC challenge is, excuse me, do you have the information? When you have the information, what do you do with that information? So having support to understand how to use that information, how to make good decisions, where the cost benefits are, how can I drive it? And by the way, it's very important that that data goes to the surgeon, because what we have found to be the most effective way to drive change within the ASC space, by the way, and it's obvious, is through the surgeon, right? So the surgeon is going to ask, why is this an opportunity? What do you have to show me? I mean, they're scientists after all, right? So what is it that you have that can help me understand what we're doing here? And then once you provide that, the surgeons almost always will be very supportive and will help drive that change. And so that's number one in the whole process, is just having the data and understanding what to do with it, and then providing it to your surgeons in a way that makes sense for them, and you can actually drive lower costs.
Yeah, let's paint that picture a little bit for our listeners. You mentioned it that surgeons may have preferred or favorite implants, and that may just be because that's what they were trained on and that's what they know best, and that's certainly fair. I mean, I know I have my favorite coffee shops and know what I'm getting when I'm in this part of town or another. But what does that conversation look like? Doc, we know you grew up on these, so to speak, and these provide a better ROI for you.
So to be clear, I don't think the conversation is around changing what they use. If they want to do that and they're open to that conversation, certainly that is a conversation. I think the conversation really is around what they use and are there better opportunities for cost savings around what they use. As you said, they were trained on those implants. They're comfortable using those implants. At the point where they use those implants, they don't want to have to think about, how do you do this or that with the implant to make it work? They're used to it. So, they keep using it. So the conversation really is around what they're using and how do you get the best price out of what they're using. Surgeons, keep in mind, when they go to the hospital, they're not involved in that discussion at all, right? They're not involved. They don't necessarily know. Sometimes they do, but they don't necessarily know the way they do in the ASC space what the cost of those implants are. So it's somewhat of a teaching opportunity, if you will. I mean, they're brilliant people, obviously, but this is a space that they need that support. So help them understand the implants that they're using, what price they're paying, what is the opportunity for savings. It won't always be a huge opportunity, but most of the time you'll find areas, particularly in their high use implants, where there are opportunities for savings. And that's really where you drive the point across.
That makes more sense then. And then to go back to another point you made around data, it seems that pre-COVID there was sort of a yearning for more data, more actionable data at the ASC, and at least from my perspective, it seems to be that post-COVID facilities, regardless of who owns them, certainly some ownership is more interested in data than others. But there's sort of been an embrace, at least from my perspective, that we really need to be measuring these things. The status quo isn't good enough. We need to know, is this better? Is this worse? And you have to have a baseline to start. I'm sure everybody's tired of the old trope. If you can't measure it, you can't manage it. But it's true. It's a trope because it's true. So, what are you seeing in terms of the embrace of data at ASCs?
I see mostly, the administrators are open. They want to understand the data. The challenge is, as I said earlier, is for sometimes how do I get the data? And sometimes it's there. Most of the time it is there in some form. And then what do I do with it? That's sometimes very intimidating. I mean, for people like myself, I mean, I'm familiar with data and I know what we do with the data and that sort of thing, but I'm certainly not an expert on how to manipulate it to get the outcome that I want. And that is the information that I want. So I think oftentimes administrators, they're a little intimidated by that. So that's a challenge. So I think having a team around them that helps them sort of understands that, whether it's pulling it and compiling it and providing the reports that are actionable so that they can use those to make their own decisions and to go to the surgeon to make them, is the real key. So I by and large see an embrace of that. The pushback is when they don't have that support, right? Then it's intimidating. So to have that support removes that intimidation factor, I've witnessed, and I think then they're willing to go that route. So the key is really having that support to help them understand what that data means oftentimes.
Absolutely. I mean, just because you're an Excel pivot table wizard doesn't mean you're going to get anything useful out of it. So at least in my experience, maybe that's
Yeah, yeah.
a reflection of me more than anything else.
And by the way, pivot tables are a foreign language to me. I've heard them, but I don't know what to do. So that's a whole other discussion.
Fair enough there. So we're talking about the cost of implants, and we had a guest a couple of weeks back who one of her pro tips for ASC administrators, and this is coming from a longtime ASC expert, is that if you're not negotiating, you really should be. So what are your thoughts there?
I agree. I mean, there's no doubt about it. I will tell you that in our experience in analyzing hundreds of data from ASCs, orthopedic ASCs, literally taking their data, comparing it against our vast benchmarking data that we have that has some of the best lowest cost for existing implants. There's almost, I'd say always, opportunities for saving. So if you're not, number one, identifying those opportunities, and then what good does it do if you don't then go negotiate right toward that lower cost? So I would agree with that 100%. I mean, to you talk about status quo, to accept the status quo when there are opportunities doesn't make sense, right? I mean, why wouldn't you? For the implants that you're using, it requires really limited effort to, once you know the opportunities, to exercise a negotiation with the device companies. And by the way, when you go to device companies, right, their goal isn't always to provide the lowest cost. I mean, they provide a great deal of value. They provide value in many different ways around the implant business. But when it comes to price, you need to go to them. They're mostly not going to come to you and say, hey, here's an opportunity for you to save money. You need to really go to them and have that discussion. And when you do go to them, armed with the data, armed with the surgeon supporting you as much as anything, and they support because of the data, you've got a high opportunity, a high chance that you're going to be successful in that negotiation. So there's no reason not to, or I should say, there's no reason to be frightened or concerned that this isn't going to work or it's a waste of time for some reason. It's not. I would say you're going to be successful a vast majority of the time if you're armed with the right information.
And as a pro tip for all of our ASC administrators and ASC staff listening, what would your recommendation be to open that dialogue with your device rep?
Yeah, again, I hate to be redundant here, but the data, right, is to have the story. Understand what the story is, understand what you're paying, understand why what you're paying. We're going to assume that you're paying too much, all right, and that you want to negotiate a lower price. Understand the benchmarking on that. Understand that, hey, your company has, you're paying $1,000 for this widget, this implant. Your company we know that we have benchmarking information that we can get it for 900, and I'm making up the numbers, of course. And so once you're armed with that, and you first go to the surgeons, because believe me, that is really the key. You have to share the information with the surgeons. If you want a pro tip, make sure you have the surgeons on your side. Why? Because if you don't go to them and they understand what's going on, the rep will then go to the surgeon, and there'll be some conversation like, so and so came to me and wants lower price. We're giving you the best price of whatever, in the region, in the state, in the country, whatever the story is. And the surgeon will push back because they don't have any other information. So that surgeon needs to be armed before the conversation with the device company takes place, so that when you have that conversation and that rep goes to the surgeon, or better yet, you say, I've already talked to Dr. So and so, and he supports this. And then when the rep goes to that surgeon, the doctor goes, yes, I do support this. I understand we're paying this. And this is where we should be paying, because this is what your company's charging other ASCs on the same implant. That's really the key, is that the surgeon's on board and you have your facts straight before you go to the device rep.
Yeah, I don't think it's redundant at all to be mentioning data. Data is a new currency, and in the right hands, it can provide incredible outcomes. Whether we're talking about for patients, look at a million encounters, a million procedures done, what gave the best outcome, on average. Same goes for negotiating a price. Having that benchmark is huge.
Yeah, no question about it. And if I can expand on that a little bit and maybe take a little bit different direction, is data too expands onto when surgeons are comparing themselves to one another. Surgeons love to compete, right? So you don't think about this, but from a business perspective, to be able to provide, for example, reports for the administrator that they can provide to the surgeons that might, compare not just outcomes, because docs obviously they care a great deal about the outcomes, their patient outcomes. But again, remember, they have a vested interest in this center, and they want to provide the best solutions all the way around, which results in the best patient care, right? And the most efficient and less costly. So part of that is, when they deliver that care, how do I compare to my other, surgeons? In other words, I'm using the same here and here, or I'm not using it. Maybe one surgeon's getting, a similar implant from one company that another surgeon is getting from another, and the discrepancy in price is enough that they go, hey, what's going on here? That's a valuable conversation for a lot of reasons, but one of the reasons is it raises awareness, right? So around that data again, it raises the awareness of the surgeons. Ideally, that surgeon who's paying more, that's using the implant that costs more, let me put it that way, is going to say, you're right. We need to look into this, right? And that's probably what they're going to do. Yes, they're competitive, but they're also on the same team, right? So they want what's best for that center. They want what's best for the patients, but they want what's best for their center as it relates to the business aspects of this. So that's also valuable on the data side, right? So there's lots of uses for that ultimately drives to the best outcomes, the best price for the implants.
Absolutely. I mean, I've never met a surgeon that wasn't competitive personally.
To say
I'm
the
not sure
least.
that it exists.
And good for them. Yeah.
Yeah, and we're talking about the profitability of cases here. When you look at it from more of a macro lens, where do you see the biggest advantage with being able to negotiate prices? Obviously, you don't ever want to do a procedure as a facility that you end up in the negative on. So where you can go from neutral to a better outcome for the facility, or to go from a red number to a black number. Can you speak to that at all?
I sure can. So there's a definition I want to throw out that everybody I'm sure understands that listens to this, and that is the difference between two basic types of payers, and one is a global payer. I call it a global payer. Those payers, like Medicare, for example, excuse me, that do not reimburse for implants. pay one fee, a capitated rate, that encompasses an area of care that includes the implant. So the importance there is get the lowest price to fit within that sort of that case, right? So, and there are other payers that reimburse for the implants. So it's interesting because you think about that in terms of cost, and you could make a case that it doesn't really matter. It does matter, but I'm just saying that you can make a case because you're going to get reimbursed. So what difference does it make? Well, that takes me to what you asked, I think, and that is case costing is important, right? So you have to understand, first of all, which the people at the ASC do understand. You have to understand what is the payer makeup of that, and then do a case cost of it, which almost all ASCs, and we provide this service as well, almost all ASCs do because they want to understand if they're going to do this case. First of all, are they going to lose money? And sometimes they do it because for different reasons, but they're willing to lose money at times. Are they going to make money, break even, whatever the case might be? So they look at those payers, they look at the costs, they look at how the costs impact whatever the payer is, and then they make an assessment. So case costing is a real key component of that. Case costing, of course, is where you take different costs that go together, that go into the surgery, labor, OR time, et cetera, and determine whether or not the reimbursement for that is going to be sufficient to cover the costs of that procedure. So that's kind of a key to that as far as understanding that, and understanding your reimbursement makeup is a key component of that as well.
Well, this goes back to something we touched on earlier. When you're determining case profitability, you're going to end up looking at data across a number of sources. Potentially your clearinghouse, your contracted rates with the payers, everything that's in your practice management software. Then you're looking at the cost of implants. I imagine that gets overwhelming in a hurry if you're not a data expert, I guess.
It really does, Eric, and that's a great point. When you think about it, and go back to something we spoke about earlier, and that is, the hiring component of it. And again, these people are so good at what they do, but they spend so much time sort of chasing different components of what we're talking about that it takes them away from maybe a patient-centric focus at times, or just doing their job that they need to get done before they leave at the end of the day, right? It sort of diverts them away. So that's where, obviously I believe that having some support on that is so important. One of the areas I want to kind of mention in conjunction with this discussion is when you think about the two types of reimbursement, you think about those payers that reimburse for implants, okay? They're often understanding those contracts is another component of that. And it gets again to the point of how much can these people understand that are sort of managing this business, right? So understanding those things, and I'll give you an example. There are contracts written that say that if the implant is less than a certain number, they won't reimburse. For example, I'll make up a number again, less than $500, they won't reimburse. Well, there are implants less than that. So, I sort of scratch my head and wonder what that's all about. But, you can understand higher than, but lower than, but it's a component. So you need to understand that when you're looking at these contracts, and what does that mean? Does it mean maybe you think you're getting reimbursed and you aren't, or whatever the case might be? So, and there are lots of little things like that you'll find in contracts. And I don't think they're gotcha things. They have their reason. I don't know what they are all the time. But the bottom line is having the capacity and the time for these people to understand all of those nuances can be a challenge. So having support to help with that is key.
Yeah, the capacity and the time obviously critical to the process, but it almost seems to me that if you're viewing this as a game to be won, eventually you probably will win. I mean, that's better than doing nothing.
Yeah, I mean, no doubt about it. I mean, look, there are solutions there. It's really not rocket science. I mean, it's not. I mean, data is the key. I mean, understanding the data is the key. And then, I think there's just so many components of this that the materials managers and the administrators and those people have to deal with before those implants are even used to make those good decisions, that I think it's really important to win. That you really either need to individually be educated on it, which is a big ask a lot of times on all these components, or have the support to actually win. And you can win at the end of the day. I mean, with the right support, with the right, in the right areas, customized support, which where you do need support, whether it's ordering or whatever the case might be, understanding the contracts, understanding how to drive an RFP, offloading that from the people who are doing that usually, which is the administrator along with the materials manager or other people, contracts negotiators, et cetera. having the support to sort of offload a lot of that and to understand the data and to know what the solution opportunities are. And that's really key as well. And that comes from the data too. That's really what's important. And absolutely, you can win. Absolutely. We see ASCs win all the time on those.
Well, I'm glad to hear that. Like we said earlier, as a consumer of healthcare myself, I think it's really important that the ASC continue to thrive and grow and expand. And speaking with the ASCA CEO, Bill Prentice, earlier this year, he shared that one of the biggest challenges ASCs face is just awareness.
Yeah, no question about it. I mean, again, they're doing a lot. They're doing an awful lot, and it goes to a lot of different things we've talked about. But absolutely, awareness, and we've spoken about that a great deal here. I kind of talk about the data as the awareness, key, and I think it is in what we're talking about. But there's also, by the way, there's also process efficiencies, along with that. I mean, how do you, like when a case is done, there's often a delay between when a case is finished and when the invoice arrives and it's adjudicated and it's paid for. That delay often it should be more than 24 to 48 hours. Certainly when we do it, that's what we strive for, is 24 to 48 hours. But oftentimes that delay can be weeks or even a month. And what does that mean? That means that the ASC cannot get their invoices into the payer to be reimbursed. What is that? That's the velocity of cash flow. That's it's cash flow period. So it's important that that's another area where sort of the awareness on how can we do this better, right? How can we sort of manage that? And again, oftentimes it's a load on those people in the ASC who are responsible for that to manage all of that. There's often mistakes on these surgery invoices and things that need to be dealt with, and that takes time, a lot of back and forth. So getting that invoice into the payer when they're being reimbursed for the implant is key. That's cash flow, it's health to the surgery center, and all those sorts of things. So that's another aspect of this that I think is really important for surgery centers to focus on. And again, you talk about winning. You need to be aware of it to win that game, right? You need to know about it. First of all, what's the solution? How do I fix this? And then you can win that game. And that's an important game, by the way, to win, because you're talking about your lifeblood, your cash flow. So, yeah, that's another piece of this, right? So,
Yeah, it sure is. A lot of gems in here for our ASC listeners, Tim. Is there anything else you think the ASC crowd has to know? What's your number one pro tip you want them to come away with?
yeah, like I said earlier, and I'm just going to throw this out again. Well, I'll do a couple of things and I'll get to my pro tip. Again, the data is important. Collect it, analyze it, compare it. If you don't know how to do it, get support to do that. And then go to the surgeons and get the surgeon support. I don't think that's foreign to anybody, but to be successful in any of these negotiations is to get the surgeon's support so that you can have that on board when the device rep goes to the surgeon. They have those discussions and you'll win those games. You will win those games. One other thing I'll say is that look to support in the other areas too. I mentioned cash flow. Look for areas, how can we do better? Be open to that. Maybe that's a better pro tip, right? Be open to the opportunities that exist to just be better. Don't settle for status quo. It's an easy thing to do, right? It's easy to go to that legacy thing that you've always done, but and I know ASCs are striving to get better and better, but be open to that and think about what are the opportunities here and listen to the advice, take the good advice and run with it. Don't be stuck in the past and in the status quo, and be willing to move forward.
Well put. And with the competitive landscape sort of tightening in on the ASCs, you have a lot of investment from PE, you have health systems sort of seeing the writing on the wall. There's a lot of interest in the space now. And for the privately owned centers or the physician owned centers, maybe with a management partner, now is the time to embrace data. Now is the time to embrace measurement. And it really does all come back to data, in my view.
Now is the time, and there's no reason to delay, right? There's no reason whatsoever. Yes, embrace that data, embrace solutions, look for opportunities to improve on efficiencies, on cost, reimbursement, et cetera. I think that's what that will drive success.
I'm with you there. Tim, for our listeners that want to learn more about you and about Advantien, where should we send them?
Yeah, I mean, Advantien.com is our website. Thanks for asking that. www.advantien.com. That's ADV as in Victor, ANTIEN.com. And from there, there's different ways to sort of converse with us, and we'd be pleased to, provide, preliminary data for them and show them the opportunities, assess their data, et cetera. So lots of opportunities there, and I appreciate you asking. Thank you. We'd love to hear from people.
My pleasure. And it was great to have you on, Tim. On behalf of the entire DocBuddy team, thanks for listening to the DocBuddy Journal. We'll catch you again next week.